A group of nearly 60 major medical organizations, including the American Medical Association and the American Nurses Association, issued a joint statement yesterday calling for all healthcare and long-term care employers to mandate their employees be fully vaccinated against COVID-19. And a new survey shared exclusively with Morning Joe shows that a majority of nurses support vaccine mandates for workers. In the American Nurses Association study, 58% of nurses said they were in favor of employers requiring vaccinations. And joining us now, President of the American Nurses Association, Dr. Ernest Grant. Given the changes even in the past 24 hours and the mandate to either get vaccinated or get tested, what has been the response among nurses across the country? And how does weekly testing really work compared to the vaccine?
Well, thank you very much for having me. There's been an extremely positive response to the mandate. Nurses are realizing that they need to be vaccinated in order to provide the care that is needed and also to prevent the possibility of acquiring the virus and taking it home to their families or spreading it to the people that they serve. And the differences between the weekly testing is that there's always the potential that right after an individual has been tested, they could acquire the virus and begin to start shedding the virus before the next time that they are due to be tested. So, that's the main differences between requiring the mandate and or the weekly testing.
Yeah, the weekly testing obviously seems like a poor substitute for a vaccine that's often 95% effective. Dr. Grant, a lot of us saw surveys earlier this week, late last week, that showed that up to 40%, 45% of healthcare workers at senior facilities, retirement homes, were not vaccinated. That was shocking to us. Can you give us any insight from what you've heard why some healthcare workers seem to be hesitant to get those vaccines? And do you have any doubt at all that we should have a requirement for healthcare workers to get those shots, especially if they're working with our senior citizens?
Well, those are some very shocking numbers. I'm in agreement with you there. I think it boils down to the fact of those healthcare workers needing a little bit more education about the vaccines and how they work so that they can do that. But anyone who is, we expect healthcare workers, nurses in particularly, to model the behavior that they expect the patients that they care for to model. So therefore, if you know that you're going to be working with a very high vulnerable population, such as senior citizens, then it's extremely important that you take every effort that you can to make sure that they are kept safe. And so we would still continue to encourage that those who are in long-term care also adhere to this mandate and also become vaccinated.
All right, President of the American Nurses Association, Dr. Ernest Grant, thank you. Next hour, we'll speak with a recent head of the American Medical Association and also New York City Mayor Bill de Blasio on the mandates he continues to roll out for city employees.